Older adults have the highest rates of insomnia more than any other age group. And about 50%, about half of older adults report insomnia symptoms. So even if they don't meet criteria for the full insomnia disorder, half of older adults are reporting symptoms consistent with insomnia. And yet, sleep issues are dismissed often as just a normal part of aging, when in fact they may not be. Fatigue is not a normal part of aging. And sleep issues, while sleep does change as we age, and we need to be paying attention to that and modifying our environment and behavior for that, it doesn't mean it's a normal part of aging. There are architectural changes in our sleep and changes in our circadian rhythm to be mindful of, but older adults still need 7 to 9 hours of sleep a night. So, if you're working with older adults, it's time to take sleep seriously, not just for quality of life, although that's really important, but for brain health and mental health too. So, let's talk about why sleep matters for brain health. Sleeping is not passive. In fact, it is incredibly powerful. Especially in deep sleep, our brain clears metabolic waste, including beta amyloid, which is implicated in Alzheimer's disease. It also helps us to consolidate memory and new learning and to help us regulate our emotional system as well. And so when sleep is disrupted night after night, so too are these processes, which can have detrimental effects down the road, including an increased risk for dementia disorders. So let me start by defining insomnia and why this matters so much. So insomnia is classified by one of three features: difficulty falling asleep, tossing and turning, not able to fall asleep for a significant period of time, or difficulty maintaining sleep, meaning that you fall asleep okay, but then wake up and have difficulty going back to sleep, or early morning awakening, or early awakening, which means waking around 3 or 4 and then having difficulty going back to sleep after a certain period of time. I'm 49, around menopause, and I'm experiencing this early morning awakening. But that's not all. The person, in order to meet diagnostic criteria for an insomnia disorder, this sleep disturbance has to cause distress or significant impairment in functioning. It also needs to occur at least 3 times a week over the course of 3 months to meet diagnostic criteria. These symptoms cannot be attributed to medication or a medical problem or another sleep disturbance, and some other nuances as well. That is the diagnostic criteria for an insomnia disorder. 50% of older adults don't have an insomnia disorder. However, 50% of older adults do report symptoms related to insomnia disorder. And so there's a lot of sleep disturbance that occurs in older adulthood. So let's talk about why older adults are particularly vulnerable to sleep disturbance. Sleep naturally changes with age. We still need 7 to 9 hours of sleep, but as I mentioned, the architecture and our circadian rhythms change. And so as we age, we get less deep sleep. We wake more frequently throughout the night, and we fall asleep earlier and wake earlier due to circadian rhythm shifts. These changes are expected, but now that you know what insomnia is, you can see that they are not the same as insomnia. Older adults also have compounding risk factors that make them more likely to wake up more frequently throughout the night, like chronic pain, caregiving concerns, other medical concerns, medication side effects, or even medication dosing where you have to wake in the night to take a medication. Increased frequency of urination, so waking throughout the night to go to the bathroom, then having difficulty falling back asleep after that. Social isolation, grief, and early stage cognitive decline or mild cognitive impairment. Even though older people may have higher risk, doesn't mean that it's a foregone conclusion. There's a lot that we can do to help. Older adults benefit from care, benefit from collaboration with their medical providers, benefit from sleep studies to understand how to optimize sleep. And you have a really important role in helping them to gain those resources and a better quality of life and better brain health down the road. So thank you for being here and doing your part because you really do have an important role in making sure that older adults get the mental health care that they need and deserve. I'm Dr. Regina Koepp. I'm a board certified clinical psychologist and geropsychologist, and I founded the Center for Mental Health and Aging. If you enjoyed this episode, please subscribe and leave a review and share with people that you think might find this helpful. It really does help other people to find this information and improve mental health for older adults. So thank you for being here and doing your part.